Patients who are released from hospitals with no one to care for them, a problem for our healthcare system nationwide. But now in Jefferson County, 2 hospitals join an innovative new program that seeks to end high readmission rates, a program being offered free of charge that keeps you out of the hospital and gets you back to your life. Our look at A Perfect Homecoming. And hello, everyone. Welcome to our conversation. We are looking at a new program today that you're going to be hearing a lot about, a national model for recovery and care and vitality that now has not 1, but 2 hospitals in the Jefferson County community involved, aimed at helping you remain as healthy and as comfortable as you could possibly be, and it is currently funded by the hospitals themselves. They're taking care of it all. Here is a look at Perfect Homecoming.
So I think she's going to be a high risk going home is the bottom line.
Lutheran Hospital's Dr. Kathy Crabtree identifies an at-need patient to care manager Stephanie Martinez.
They might need home modifications, they might need some house cleaning, meal delivery, groceries, and then also people who need assistance in getting to follow-up appointments.
And remarkably, Martinez can access all of those services for a patient free of charge through a program administered by the hospital and the Seniors Resource Center. SRC has a large transportation system, complete with buses fully equipped to accommodate patients who aren't mobile. And the meals they offer, a critical component, are all prepared in their own professional kitchens.
Our vegetable medley.
They are nutrient-dense, naturally seasoned, and prepared by professional chef John Selters.
Usually for the first day when they get out of the hospital, it's very difficult to do some things, so we provide a boxed lunch.
And that's just the beginning of a large menu of other services.
And in addition to that, they can also receive some in-home care services. So somebody who can come into their home, maybe make the bed, change the sheets, clean the refrigerator, prepare a meal, do some dishes, and then additionally maybe some personal care if needed.
Care managers arrive with meals and assess other needs. Professional house help makes certain that a residence is clean and absent of clutter or obstructions that could cause a fall, all at no expense to a client. The initial rollout has been so successful that a second hospital is now joining the program. St. Anthony says it completes their circle of care.
Will allow a number of people to go home who otherwise might have need to go to a nursing facility or a rehab facility because they just don't have the resources at home to help them make a smooth transition back home instead of being discharged elsewhere.
Now, however, they can indeed make a perfect homecoming. There's a look at Perfect Homecoming, just a marvelous program. Our guest today to talk about this, Kendra Kaysen, who's Director of Care Management at Lutheran Medical Center, Monica Roars, who is President and CEO of the Seniors Resource Center in Denver, and Robert Hayes, who is an injury prevention specialist at St. Anthony Hospital, kind of the newcomer to the group, I should point out. Welcome, Robert, but I'm sure you're all fast friends by now. Monica, let me start with you because the Seniors Resource Center seems to be perfectly positioned to manage this program. So let's talk about your assets for a minute. You have a lot of different arms.
Seniors Resource Center has been around for 40 years, and in those 40 years we have developed a wide array of services to help seniors age in place, to help them remain in their homes. Those services include transportation services to doctor's appointments and grocery shopping. They include adult day programs for people who have dementia or Alzheimer's. We provide in-home care services to help people who are living in their homes have assistance with housekeeping and personal care like bathing. And we provide a lot of care management to just answer questions and help connect seniors and their families or caregivers with resources that they need to stay in their homes.
Marvelous. Now you're gathering up all your resources to be part of Perfect Homecoming. And Kendra, your hospital was more or less the first in the pool with this, and it's a very dynamic thing to be in your hospital and watch your care managers sort this out for patients. And they're actually more or less on the front line in the hospitals for the project.
Right. So they're really doing that initial assessment to really look at what the patient and their family may need upon discharge to help them be supported in their home environment, which is where everyone wants to be when they're discharging from the hospital. There's no place like home. And so what we wanted to do is stretch from the hospital walls into the community and help bridge that gap for our shared community and make sure that they have everything they need to be supported.
Such a wonderful opportunity. As I explain it to caregivers, they look at me like I'm crazy, you know, Robert, and I'm so glad that St. Anthony is jumping in as well. What do you think motivated the hospital looking at this to make them think, hey, this is a great idea for us too?
Oh, it's a wonderful opportunity for us, and we're very thankful that they came to us and had that conversation. It's a wonderful program. They really look at the whole person. And one of the things that I think is so important to people when they're leaving the hospital is to have that warm handoff, that ability to have someone come and meet with them and get them home and make sure that they have the things that they need so that they don't have to be readmitted back to the hospital. And so we saw the success of the program, and we were very excited to be able to join the group.
And readmissions have been a problem for the hospitals. There are fines involved. I know the hospitals are always doing their best to lower their recidivism rates. And Monica, you're standing right in the middle of all of this. And so as they identify the patients in the hospital, as this goes down the line and they turn them over to you, what is the first thing that you explain to them that's next for them? Or maybe all that setup occurs in the hospital. By the time they get to you, they're ready to jump into the program.
Well, we're actually doing a warm handoff at the hospital. So Kendra's team calls Seniors Resource Center before the patient's ready to leave the hospital. We're getting on the same page with our care managers and the hospital care management staff to make sure that we understand what the client's going to need. We talk about the discharge plans, and then we meet them at their home. We often are bringing them nutritious meals to make sure that once they get home, they're going to be fed well the first few days. And we're also figuring out a plan of what other services they're going to be needing, whether we're going to need to provide transportation to get them to and from appointments or rehab. We're looking at whether or not they're going to need somebody to come in and install grab bars or do some kind of adaptations to the home to make sure that they won't trip and fall, which is one of Robert's specialties. We also are looking at whether or not they're going to need somebody to come in and do light housekeeping. So we're developing that plan when they leave the hospital, and then we're meeting them at home, in their homes, and helping to carry out that plan. We'll do it for either up to 30 days on our silver plan or up to 90 days on the gold plan if they need more intensive services.
I'm so impressed with your commercial kitchens over there, and John, your chef, he's a wonderful guy, and he's this wonderful caring guy who really understands the transition from hospital to home. The guy's even making box lunches for the first day because he knows they're a little delicate. Tell me, first of all, how do you identify a patient? I mean, do you have a criteria for every patient, or is it different for every patient that you identify?
Well, I think every patient, is unique, obviously. We do have a lot of elderly people in our community that don't have a good support system. They may not have family that can help support them when they get home. They may not have friends that maybe they don't feel comfortable asking for help. So really, they're kind of on their own when they get home, and that's pretty scary for them.
And terrible for caregivers, too.
Yeah, absolutely. If they have caregivers, definitely. So what we found is that, a lot of times they do come back to the hospital for some of these things that they're just not able, they don't have adequate support at home. So they may readmit for things that we could avoid. Having programs like this and support and people in the home really has decreased our readmissions for this kind of at-risk population. So there is some criteria. However, if they don't meet that criteria for the hospital, for the foundation to pay for this program, we still refer them to the Senior Resource Center because they have so many other programs that are appropriate. And so maybe if they don't fit this exact program, they're bound to fit into something that they have to offer.
Right. Is that your model too, Robert? Is St. Anthony looking at the same type of?
Absolutely.
Yeah.
We're still new in the program and looking at that process, but I think for us is we're looking at the people that would need the services the most, and the older adults that would be at risk of being readmitted. This program alleviates a lot of their fears. To go home after an illness, it may be their first illness. They're just trying to figure it out, and to be able to have the meal in their home, the transportation, and all those kind of things, it brings a comfort not only to that patient but also to their family members and to their relatives that help take care of them.
Right. So, Monica, how many patients do you think the program could handle? I know you're just ramping up right now, but I would think, first of all, potentially there would be a lot of of these people. There would be a lot of these cases, and that many of them would need the services. So how many people do you think you could handle as we ramp up?
We actually haven't capped a number. We actually, over the past year, have served over 60 referrals from Lutheran Medical Center. We are gearing up to do even more of that with Lutheran Medical Center, and with St. Anthony, that capacity could grow even more. So we actually, now that we have the program model in place, we will just hire as many additional care managers as are needed to kind of ramp up. So there's really, at this point, we have not put a maximum number on it. We are open to working not only with the referrals that we're going to get from Lutheran and from St. Anthony hospitals, but we're also open to self-referrals. So if somebody's listening today and they either themselves or have a loved one who is going into the hospital for a hip replacement, and they're looking ahead and realizing that that loved one is going to need some help when they get home, they can just give us a call, and we provide this service not only in partnership with the hospitals with their financial support, but we also do it on a private fee-paying basis as well.
And you have why don't you go ahead and we'll give the phone number in case someone's going, gee, so who do I call?
Yes.
In fact, you have a phone number for
We
them
do.
to call.
They can call 303-235-6923.
Okay, and that's Seniors Resource Center. Right, okay. So one of the most marvelous things about this for so many of these people, Kendra, they are, many of them, not necessarily indigent, but their budgets are stretched. Yeah. So the Hospital Foundation has initially stepped in to help with this.
Right. Yeah. And that is, this is the community that we serve. And, that is something that's very important, has always been important to Lutheran, and I'm sure for St. Anthony's as well, for their structure. It's more than just treating people at a hospital. It's really, this is our community, and how we can best serve them is why we're all in this, what we do to begin with. So it's really nice that our foundation lines up with that and has really added this support to people who would otherwise not get this support. Right. It's just not out there. It doesn't exist. We're so fortunate to have great partners who are willing.
National model, as I said.
Yeah.
I mean, there's a lot of hospitals looking at this now across the country.
So we were able to think outside the box, and luckily we have great community partners that are able to kind of do the same thing, and we were able to kind of come up with this idea, and it's been a really wonderful partnership.
And St. Anthony's got the same model, right? Exactly the same.
Yeah. We're both faith-based organizations with strong missions to take care of people in our community. And so we don't see the end of that care when you leave the four walls of the hospital.
Right.
And
Jefferson County is so fortunate to have not one, but two hospitals. Yeah. And the Seniors Resource Center in the middle. And I happen to know that there are positions available for people at this. I mean, we're always, in this economy, hiring good people is no small thing. And I have firsthand knowledge of the transportation division. I, in fact, was an excellent driver, you should know. I actually did a story on it once and got to drive the bus. And I always tell your transportation director, I tell Hank, I terrified a lot of people, but killed no one. So I counted that as a success. Because the buses are complex. I mean, they're very high tech. And I know that there are opportunities. People should know, especially the bus jobs. Those are federal jobs. So there are 401ks, there are health plans, there's paid training. There's a lot of advantages to having these jobs. And in fact, you do have some openings.
We do. We are looking to hire drivers, and as you said, that's drivers who could be driving our small buses, but we also have a fleet of minivans and Priuses, so we kind of have different vehicles for different needs and different transportation lengths. And so we're looking to hire drivers. We also are looking to hire intake in-home care specialists. We call them personal care attendants. And we are also looking to hire some folks who could help us with our program, our adult day program, which we have 3 locations throughout the metro area where we are caring for people who have dementia, who are living at home with loved ones, but who also are needing some place to go during the day for recreation while their caregivers get some respite. So we are also looking for folks to help us with those services.
What a program. We provide services, we provide employment. There's nothing we can't do here. The Alzheimer's Association put out a new number just this week that somewhere in the world, someone is diagnosed with dementia now every 3 seconds. In the United States, there's an Alzheimer's diagnosis every 65 seconds, usually a woman. So the needs for a program like this just increase. How many care managers do you have now, and do you see that expanding with the program, or are you at a number now that you can manage the staff?
We currently we're very fortunate. We have about on our entire team, we have about 30 care managers, we have RN discharge navigators, we have utilization review nurses, so it's kind of a layered approach. We're in a really good spot for that, and we have more care managers so that we can be more proactive and really identify what our community is going to need upon discharge. So we can go a lot deeper into really peeling back the layers and making sure we have all the support systems in place.
Yeah, not just identifying help, but identifying the right kind of help.
Right, what's going to make them successful outside of our four walls.
Right. And Robert, you made a good point a moment ago. You're an injury prevention specialist guy, a fall prevention guy. Nobody just falls and hits the bed anymore. It's like, as you said, when they do it, they really do it right.
They're right. That's exactly right. And in Colorado, about 50% of injuries are related to falls. And they dramatically increase as we age. Now, age is one of those things that we can't change, right? We're going to age. However, there's things that we can change in the homes. Environmental things, vision, medications, just a wide variety of things that we can change. And a perfect homecoming actually addresses a lot of those things, especially for people that are going home that are at risk of falling, and to make those changes so that it reduces their risk.
Right. I know I've seen, as I've followed the story, there's always bars, especially in the bathroom, installed in the showers and around the tubs, and special assistants in the kitchen, and also just around the home. Someone made a really good point, I think one of your caregivers the other day, that a lot of these people prior to being ill had trouble keeping house, so there's a lot of tripping hazards and things around the house. And that's one of the first things they do when they come in. They kind of open the pathways.
Yes, and especially if somebody's going home with a walker for the first time, they might need to move the coffee table a little bit further away from the couch so they can get around. It might be that there's cords that are, kind of coming across the walkway that need to be hidden so that nobody's going to trip on those cords. So rugs. So we do go in and do a thorough assessment of kind of what the risks are, and then if it is something that we can easily move with our care management staff, we'll do that. If we need to get one of our team members in to install a grab bar, or sometimes it's even a ramp, we'll do whatever we need to make sure that there's going to be easy pathway through the home.
You have people who can build ramps. This
We do.
amazes me. People who will do that sort of thing. That's pretty remarkable. I had a caregiver ask me, her, I believe it's her aunt and her mother, a family member who is mentally, cognitively compromised, dementia leading to Alzheimer's, I think she said. But she's younger, she had early onset. Is there a place in the program for people, say, well, as early as their 40s and 50s? I know you manage a lot of older patients, but you can cover the whole spectrum of age? I mean,
we certainly want, the population to go where the needs can be met. And so I think, they do have some programming for some younger, kind of more at-risk adults as well. I'm not sure what the cutoff age is. I don't know if there is a set number.
We have a lot of our funding comes through the Older Americans Act, and that funding allows us to provide our services to people 60 or older for most of our programs. But we do actually have an active adult center for folks who have younger adults who have some kind of intellectual disability, and we sometimes it could be appropriate for somebody with early onset Alzheimer's, or it could be that they may be appropriate even just for an adult day program with other older folks who have dementia. So we're open to talking with family members who are experiencing that and trying to figure out how we can find the most appropriate referral if it's not with Seniors Resource Center, but it could very well be.
Room for payers then, for sure. Do you see a lot of those at St. Anthony, Robert? I know both hospitals, that there's a large population of older Americans in Jefferson County, but do you see a lot of patients who would fit younger age groups as well, who might fit into the program at St. Anthony?
I think we do from time to time, and we always want to make sure that the referral is to the most appropriate agency. I think both hospitals have great relationships with community partners across the metro area, and so we reach out to them and really get people to where they need to be for the care that they need. So depending on their age, the condition, if they need, like you mentioned earlier, the adaptive equipment in their homes, a variety of things.
I know your doctors at St. Anthony are so enthusiastic about the program as they are at Lutheran, and I had doctors tell me, this was a doctor at Lutheran who told me, you know what, we do great work here and we make everybody healthy again after their surgery. We patch them up, we fix it, and then there's always great trepidation, this physician told me, about then just sending them on their way. And previously, for a lot of people, that was the edge of the cliff because, as you mentioned, they just didn't have the care leaving the hospital. So doctors have now expressed to me that they are in 100%. I know at Lutheran, I don't know how many, we talked to 4 or 5 doctors there, and every one of them said, this is a great program.
Yeah, absolutely. I think the entire care team, nobody feels good about, discharging, an at-risk adult, whether they're elderly or younger, to an environment where you just don't feel they have the support that they need. So this gives everyone that peace of mind when they're leaving our hospital. We're handing them off into our community partners. We know they're in a good place, and that, makes us all sleep better at night.
And this program we found to be appropriate not only for people who may have family out of town and don't have family here, or maybe they are their family members have been deceased, but also for people who do have family members who may just be overwhelmed and may not know what kind of care to give their mother who's coming home after some surgery, and so we can go in to the home and help assess not only what would be needed for somebody who doesn't have caregivers, but even if they do have caregivers who are kind of overwhelmed or confused or not sure what's needed, we can help kind of create a path forward for them so that they can get home, stay home safely, and recover where they want to be, which is at home, not in the hospital.
Right, and I've seen that happen with caregivers. Caregivers are the first to go over the wall if there's a crisis in a family. They're trying to manage their own lives, often their young children's lives, and take care of mom and dad or an aunt or an uncle. And you see a lot of that at St. Anthony too, Robert? I mean, do you focus on caregivers when?
We do.
Yeah.
We have several different partners that we work with in the Jefferson County area that we can refer people to. But one of the things I think as mission-based, faith-based hospitals is we recognize that we have to take care of that patient plus the whole family. Right. And so we take that extra time to make sure that they have what they need when they're going home, and we listen to them. I think sometimes that's has the biggest impact, is just being able to listen to them and let them share their concerns and then addressing them. So absolutely. And the other thing I wanted to mention too, when we were talking about falls, that I think is key to this process is this is from hospital to home, and a lot of them may be homebound at that time. However, as they're taken care of and they get the things that they need, they may be out and about. And both hospital systems offer evidence-based falls prevention programs, A Matter of Balance at Lutheran and Stepping On at St. Anthony Hospital. And so these are 7 or 8 week long programs that people can then attend those programs to help keep them from being at a risk of fall. So there is that continuation of care even after they complete the program with a perfect homecoming.
And you can adjust the program on the fly if there's something else the patient needs. I mean, you're probably constantly adjusting it as you go along.
We absolutely are. So every client in the Perfect Homecoming so far, they've had the care management services where we've gone in and done the assessment and figured out what kind of resources they needed. Most of the families have opted into the meals program. I think 85% of the families have appreciated that.
And the food is fabulous. I could
Food
attest
is
to that.
It's wonderful.
And our
I'm an eater.
And our chef does also look at whether people have diabetes or maybe they have a low sugar, low salt diet. So we kind of make adaptations based on what the individual client needs. But not everybody needs transportation services. Maybe they do have a loved one who can transport them back and forth to doctor's appointments. So, but if that were to change and they needed to have some additional transportation added into the mix, we can do that. Not everybody opts into the light housekeeping initially, but they realize maybe after they've gotten into the program that they could really use some help. Maybe it's just developing more trust with our caregivers, and next thing you know, we are actually helping them with the laundry or doing the dishes or helping with the housekeeping. So we can make adaptations based on what the family needs, up or down, depending on what's needed.
I know patients are impressed by it, but I know caregivers are blown away. Oh, they're going to do dishes, they're going to deliver the meals, and the food, as I said, is so nutritious. Your chef is a great guy. That's such a big component. I'm sure for recovery that's a big component. I mean, nutrition is a critical item in this list.
Absolutely.
and the food is spectacular.
You know, if it's often the wife who's coming home from the hospital, we'll bring a meal for her husband too, because if she's not cooking, he's not eating either. So we want to make sure that the whole family is really being cared for.
The whole family concept is key, because it all collapses around that if just one little thing goes wrong. So it's wonderful that you adjust. Is there a bridge too far? Is there a patient? Do you have those moments where there's a patient who is so injured or has so many things wrong? I mean, this is a technical medical question. I only play a doctor on TV, so I have no real medical knowledge, as you know. But is there a bridge too far for a patient where you arrive at a moment and you just say, there's just no way we can deliver this person at home, or do you have to do another step before they go home? You know what I mean?
Sometimes we have recommendations that are not, the first recommendation maybe isn't home. But if what we often get with those meetings is the patient and the family, will acknowledge the recommendation and then say, we're going home. So we respect that decision. And so then that's just where we have to pull as much resources and things that we can together to help support that desire. That is still their decision to make, whether they're going to try and go home. And maybe it won't work, and maybe that's not the best decision we find out, but we're going to try, because that's their desire.
Right.
So we're going to do everything we can to support them in that decision.
I know I'm getting calls already from other hospital administrators want to know, so what is this, and who are these people, and how does this work? And we weren't really sure that was the Seniors Resource Center's mission, and they're actually, and I mean, yes, this is happening. So I just can't imagine that this just doesn't continue to. I mean, why would it not? I mean, it's the perfect solution for hospitals.
It absolutely is. And so we started off with Lutheran Hospital, which is right around the corner from Seniors Resource Center in Wheat Ridge, as our closest partner, and we expanded to St. Anthony. But we do envision that this could be growing across the metro area to partnerships with other hospitals, other medical facilities. It could even be skilled nursing facilities once people are leaving those and after rehab and going home. So there is a lot of potential, and we feel good about the fact that in our first year we've gotten kind of the kinks worked out of how the process works with Lutheran Medical Center, and now we're rolling out the partnership with St. Anthony. So kind of the world's open to us in terms of what other opportunities we'll have in the future.
I'm betting St. Anthony jumped in because it looked like such a well-oiled machine at Lutheran.
Absolutely.
It works so well. For caregivers, for doctors, for patients, certainly for doctors and other medical staff, it's a big win. Sometimes when I stand at because I've been to both of your hospitals, I stand at the nursing station, and we're almost out of time, but I have to ask this question. Sometimes it seems so busy. Do you worry people will fall through the cracks? I mean, your hospitals are manic sometimes. It's insane what's going on. Do you worry that maybe somebody might slip through the cracks?
I mean, organized chaos, It may appear that way, but it's really a well-oiled machine.
Oh my gosh, I mean, there'll be 6 or 8 nurses at a nursing station, and they all seem to be following a different thread, and patients moving in and out. I mean, hospitals, people have no idea how busy they are.
They're big and complex, and they're like a machine. Yeah. But we have numerous committees that look at quality, they look at process improvement, they look at ways in which we can improve the care to our patients, and that we don't have patients fall through the cracks. So, and I know they do that at Lutheran as well. And so, yeah, that's a primary thing, is to make sure that our patients are safe and that they get the care that they need while they're in the hospital, as well as when they go
Marvelous.
home.
You're the first people I would want to meet if I went into a hospital. You're so caring and giving. Good on all of you. It's marvelous. Monica, give the phone number one more time in the few seconds we have
It's
here.
303-235-6923.
There you go. And it is called A Perfect Homecoming. Thanks to all of you today for being here and explaining this marvelous program. And great good luck to you as we go forward here. Thanks to you. And thanks to all of you. Have a wonderful day.